on the issue of healthcare, it is my opinion that the system we have right now is broken in an extremely, how should I put this? It is broken almost irreparably. The system is designed so that insurance companies can extort as much money as they like from consumers. Those who cannot afford health insurance must rely upon the government to pay for their health care. And for those who are not poor enough to receive government aid, yet not wealthy enough to afford health insurance, are simply left by the wayside. With this in mind, I propose the following legislative changes. All insurance companies shall hereby be required to offer basic plans that will cover illness, accident, pregnancy, and basic medication on a non-profit basis. In other words, the insurance companies must provide these services to all citizens regardless of gender, age, ailments, or any other condition. They must provide them fairly and without profit. This does not mean that insurance companies cannot offer more services without a profit. Dental plans would not be required under these basic plans. Insurance companies would be more than welcome to earn a profit on dental insurance plans. Similarly, private care will not be phased out. Those who wish to start private care are more than welcome to do so, though they should not expect government support. With this in mind, insurance companies being required to allow citizens to buy basic health insurance on a non-profit basis, citizens will be required by law to buy health insurance. This is the only way the system I propose can work effectively, and it is also fair. It is unreasonable to expect the insurance companies to make a sacrifice, but not have the citizens make one. Under this new program, those who will still not be able to afford health insurance, which is projected, still not able to afford basic health insurance, which is projected to cost around $355 a month, as opposed to $1,005 per month it is currently, would be subsidized. Any person whose health insurance expenditures exceeds 25% of their income would be entitled to government support to make up the difference. Under this system, Medicaid will be an unnecessary program and will be scrapped entirely. This will result in a savings for the federal government of $190 billion. The annual expenditures for Medicaid are actually $209 billion. But if we assume that the 44 million unemployed Americans all require the government to pay the entirety of their health insurance fees at $325 a month, the government is only expected to have to pay $19 billion, meaning a total savings of $190 billion. Under this system, consumers would save huge amounts of money, and the competitive nature of the market would be preserved. To ensure that this system is not exploited by healthcare providers who really wish to charge exorbitant prices for their services, which the insurance companies will then have to pay, a new regulatory agency will be set up to ensure that extortionist prices are not being levied upon the consumer. In this way, the system will be fair, it will be free market, and it will serve all citizens. That, I thank you very much. Questions? Yes, sir.
So you say that all captured people from armies will be treated as POWs rather than unlawful combatants.
That is correct.
What about groups, people captured from groups that are not technically considered an army, that are not, in other words, recognized by countries?
I think you will find, if you listen to my speech, I said that all people captured by the US military will be treated as POWs. All of them. Next question.
Regardless of crime, intent, purpose, or possible escape plans to allow them into the US?
Absolutely. I have firm faith in our military that they can indeed detain those who they in fact capture. For this, I have also noted that we will not be closing Guantanamo Bay for the simple reason that fears have been raised that a possible escape attempt may be made from a US prison, which are understandably somewhat less secure. We do not wish for attacks to be made on US soil. Therefore, we will not be closing Guantanamo Bay. Yes.
Will those POWs continue to be tried by military commissions?
The POWs will continue to be tried by military commissions. However, they will have the right to a fair and speedy trial. They will not be held indefinitely as has been in the past. They have the right to bring their case before a tribunal where they shall be tried fairly and balanced. Yes, sir.
Mr. President, you said that anyone captured by the U.S. military would be considered a POW, correct?
Correct.
So then, does that fall under U.S. citizens being captured in say, police actions inside the United States? Would they be considered POWs?
No, they would not be considered POWs. In fact, I do not think that any U.S. citizen has been captured by the U.S. military recently, though I'd have to recheck the data. The use of military force on U.S. soil does require a special authorization from myself, and I can assure you that I'm not about to sign one anytime soon. Next question.
On the issue of offshore drilling, you said that you would be saving the offshore continental shelf in the case of dire needs, such as an oil embargo. However, there is a 5 to 10 year gap between setting up rigs and the actual oil production. How do you reconcile this?
I would reconcile it by proposing to you that, in fact, the outer continental shelf is not our only reserve of oil. We do have extensive reserves of oil in state waters, and those have by no means been exhausted, and they do not look like they will be exhausted anytime soon. Therefore, I propose that in the event of an oil embargo, as you suggest, expedited permits would be granted to those who wish to build oil rigs, which I expect will decrease the time needed to build them substantially. Next question.
Mr. President, what do you say about border security?
What do I have to say about border security? I firmly believe that if you come into this nation, you should be subject to the laws of this nation. One of the laws of this nation is that you must have a visa to be here if you are not a citizen, or you must have some other valid form of identification or reason to be here. As such, I firmly believe that anyone who is caught here without a lawful reason should be deported with all possible haste. Yes?
Mr. President, what is your stance on illegal immigrants receiving health care or government-subsidized health care?
I firmly believe that human dignity dictates that if someone comes to a hospital in need of care, they should be granted it. However, you will note that under my plan, every citizen will be required by law to purchase health insurance. Therefore, once you go to a hospital, you will be asked to produce health insurance. If you cannot produce it, you will be investigated to see why you cannot produce it. If you are a citizen and you have not purchased healthcare, you will be prosecuted and fined. If you are not a citizen and you have received healthcare, you will be turned over to the proper immigration authorities, who will then deal with you.
After you receive?
After they receive healthcare, yes. I firmly believe that we must treat all humans with dignity.